Okay, so here we are going to talk about the hip bone, more formally known as the coxal bone. That's, I think, the easiest way. You can get into os coxa or ossa coxa if you're referring to one, but coxal bone is just the grouping, the more formal name for your hip. All right, and so we're going to be talking about 17 structures on this. We're also going to try to figure out some key features that help separate or help distinguish between males and females. We're going to start by looking at a left us part of the coxal bone, all right, left coxal bone. And the reason I know it's left is because this structure right here, this flat end, it's called what would be here is a piece of cartilage called the pubic symphysis that connects the two coxal bones together. And it's also a part of the pubis, which is a bone that's fused to make up part of the coxal bone. But this part, it's just like a belt buckle, it faces anterior. Right? The other structure that I use to figure out left or right is back here called the ischial tuberosity. Right? It's this rough patch on the ischium, which is another bone that's fused. Right? And that's going to face posterior and inferior. So I set those two things up, and I know that this is a left coxal bone. All right, so like I said, there's 17 features that we want you to be aware of, and we're just going to walk our way through them. The first are three bones: the pubis, the ischium down here, and then the ilium. All right, so three bones that during development, or they develop separately and then fuse to become that singular coxal bone. All right, so three bones. On the ilium, there's 10 structures, and luckily most of them are grouped together. We have the iliac crest, like the crest of a wave, right? So iliac crest. Iliac fossa, if you remember that a fossa is a depression or an indentation. Right? Fossa literally means to dig, so it's kind of digging a little trench here in the iliac, or the ilium. So you have the iliac crest, the iliac fossa, and then you have four spines. You have the anterior superior iliac spine, anterior inferior iliac spine, and then on the posterior portion you have a posterior superior iliac spine, posterior inferior iliac spine. So that's kind of why it's important to figure out left to right, because if you figure out left to right, you know what's anterior, posterior, medial, lateral. All right, so those were six. We have the sacroiliac joint right here. Right, this is where the sacrum is going to sit and come in and articulate with the coxal bones. So you can see right here, right, this structure, kind of awkward. All right, so right here is your sacroiliac joint. All right, so again, we're back in this position. We work our way down, and we have a greater sciatic notch. You have what's called the spine of ischium, and then an inferior sciatic notch. So greater sciatic notch, spine of ischium, inferior sciatic notch. This structure right here is it's called the acetabulum, and it's where the head of your femur sits in and articulates. So that's actually forming your hip joint. Right? And it gets that name acetabulum. So if you the Romans or the Greeks, whoever came up with that name, thought it looked like this little cup that held acetic acid or vinegar. So it's their little vinegar cup resembled this structure right here, and so it got that same name. They weren't that creative. That's why a lot of things share the same names, but it's kind of cool to think that, okay, acetabulum comes from the vinegar cup. All right, so we've worked our way down. This structure right here is called the obturator foramen. Foramen is just a hole. Obturator has the same root as obtuse, and it gets that name because there's a lot of ligaments and muscles that sit over this, so it's kind of hidden in there. So it's this hidden little hole in your hip. All right, so we have an obturator foramen. Our pubis, or really the pubic symphysis, this little fibrocartilage that's not really shown here, but is considered part of the structures that you need to know. And then the ischial tuberosity, which we've already talked about. And those are all the structures that you need to know on the hip. And so the other thing we mentioned we were going to talk about is trying to figure out a left or right. And there's a couple features that you can use. All right. So here I have a broken male pelvis. Let's try to relocate that. Okay, male and a female. Right. So if you look at what's called the pubic angle, which is this structure right in here, it's going to be much wider in females. So, oh man, there we go. In my right hand, I have a male. You can see that the angle, the pubic angle, is less than 90 degrees. In females, it's much larger. The other feature that you can use is the obturator foramen. So if you look in the females, it's much rounder and smaller than a male's. Let's see a male. There we go. So males tend to be much more triangular, right, than a female's. The other features that you can use are, if you look, this one actually has the coccyx broken off, but the coccyx in males is going to face much more anterior than a female's. The other feature that you can also use is a greater sciatic notch. If you compare a male, this is a female right here, it's going to be more circular, and versus a male, it's a male right here, it's going to be much more angular. So if you look at the greater sciatic notch, which is right here, very circular. When you compare it to a male's, it's much angular. So that's pretty general. We'll talk about a little bit more detail in class, but those are some of the general features that you can use to figure out the difference between a male or female, right? So you have a more angular obturator foramen in males. You have a more angular pubic angle in males. The coccyx tends to face more anterior in males. And the other feature that I didn't mention yet is that the flare of the basin. So if you think of the iliac vest basin, which is kind of the fossas and the crest here, and on either side, it's going to be much more angular or up and down in males than females. And so here's a female. You can kind of see how it's very flared out, and that helps support the weight of a child more evenly. All right, and so those are some of the key features of the coxal bones.